right. So this month on the Healthcare Channel, we are going to address the issue or talk about mental health. So I'm going to let the doctor introduce herself and tell us what you do and where you're from.
Sure. So my name is Dr. Liz Hudson. I am a psychiatric mental health nurse practitioner. I'm an associate professor at Texas Tech University Health Sciences Center. And I'm also the program director for our psychiatric mental health nurse practitioner program, where we have students all over the state of Texas doing their clinical rotations and then hopefully going to be working in those communities upon graduation. So I'm
Oh,
excited to be here today to talk to you all.
okay, great. So I want to start with why do you think that all of a sudden there's been this intense, probably within the last year or two, conversation about mental health and the issue that it's created not only in our workforce, in our organizations, but also in our schools, just everywhere. What do you think the underlying reason is for that?
Yeah. So I think that there's a few different things, of course, right? And it's kind of different for everyone and every different population. So, first, to talk about the elephant in the room that gets blamed a lot, the pandemic. The pandemic was a huge kind of like catalyst for a lot of mental health issues. People were isolated, they were lonely, they couldn't do the things that they enjoyed, and our world changed, right? But if we really look at things, this mental health problems had been increasing even before the pandemic, especially in pediatric populations where we've been seeing like increased referrals and just shortages, especially across a state like Texas. So I think in many ways, the pandemic was the catalyst, but it was also a big catalyst for some improvements. The stigma of seeking mental health care went down during the pandemic because we were talking about it, right? The other big thing that happened, which has been huge, is telehealth services boomed. Even I like to share the story that myself as a provider in 2019, someone said you should start to do telehealth. And I thought to myself, I can't do that. Like, what if this happened? What if this happened? And then what do you know? March 2020, I started offering telehealth services, and I actually do exclusive telehealth services now, and a lot of providers do. It's one of the strengths of our program at Texas Tech for our psychiatric mental health nurse practitioners. We're an online program, so we really try our best to get students who are in more rural or underserved areas because they want to stay there and be the providers there. We also offer a telehealth course on how to provide those services, and we actually had that course before the pandemic happened, so we've really been able to strengthen it. So I think that, mental health has been increasing the world is more stressful. We're in a more 24/7 world. Technology is another big reason I think that mental health problems have increased. We never turn it off, right? We wake up in the morning, we look at our phone. Emails are supposed to end at 5 o'clock, but we know that they don't. We check our emails. We work 24/7, and there's no time to disconnect the way that we used to have. And that's something similar too with our children in schools. They used to be able to go home on the weekend and not find out that maybe their friends were hanging out without them, but now they see it live and in person. So
Yeah.
a lot of different factors leading to it, but I like to be optimistic and think there's a lot of things that have happened recently that have decreased stigma and increased our resources for mental health services.
Okay. So do you think too that just the whole modern lifestyle, social pressures. I mean, there's just you could just like name 50 things that we're all bombarded with. But what about the early signs? So when we begin to suspect, what are some of the early signs that someone can look for in their workplace as to there's a problem
Yeah.
or
So
potentially a problem?
yeah. There's a few different warning signs, I would say. The first one is that feeling of overwhelm. That's probably the first thing, right? And we all feel that at times, right? And when we feel that those feelings of being overwhelmed, we have a choice. We can either cut back on what we're doing or we can trudge through it. When we decide to trudge through it, that's when the next warning signs start to come up where maybe we start to notice that we're not enjoying things that we used to enjoy as much. We're not finding pleasure in our jobs where we used to have that pleasure, or maybe it's the hobbies outside of work that you used to look forward to doing. My teenagers tell me blah, like everything's just like, so it's that kind of like blah feeling that might be one of the first warning signs that something's really happening. And then that can lead to problem sleeping. Some people just feel like they want to sleep all the time. Some people lay in bed and can't sleep at all. Changes in appetite is another early one, whether it's eating too much or the converse, eating too little. I really think that oftentimes people don't identify depressed mood as that first symptom. It's some of these other kind of symptoms that lead up to that. All of a sudden, you're in this complete funk that you can't get out of.
Okay. So what are some things that employers can do to create an environment that helps support mental health?
Yeah, I think that there's a lot of things that employers can do. I think that the one thing that a lot of places are moving towards is having a chief wellness officer. Big
Yeah.
universities and large employment places of employment are starting to consider that. But even small businesses, you can think about how to make it a happy, healthy work environment.
Hmm.
Happy, healthy workers are more productive as well. So it's kind of this win-win situation for everyone. I want to give the example of nurses, of RNs. We know that there's a huge amount of RNs who leave their first RN job within the first year of employment, but supportive work environments are the things that keep them in there. So if employers can be supportive, whether that being offering a flexible schedule when you can, maybe people need time off to go to the doctor, to do these appointments, to stay healthy, making sure that there's like flexible time, comp time, someone to cover appropriately if needed. I think that having like team building, making sure that coworkers get along and trust each other is always going to be huge. So those team retreats, even though, people might kind of laugh and whatever, they're really important to make sure that everyone's working together well. Considering even like mental health days, the same that we consider physical health days, are going to be an important thing that a lot of companies are starting to move towards. And even in schools, it's becoming more acceptable if a student needs a mental health day or time off for mental health.
As you say this, the thing that pops into my head is, do you think that we're ever going to get to the point where this isn't an issue?
No.
I know there has been one. There's always been, like, since the beginning of humans, right? But like, just looking into the future, what does what does that look like? What are we talking about in your world as
Yeah.
to, when you guys get together and talk about, what are you saying about the future?
Yeah. So I don't think we're ever going to completely get rid of the issues that we have because, to be honest, we're probably not ever going to get rid of some of our other physical health issues. As much as we will do everything we can, we're never going to completely eliminate heart disease, right? Because our hearts are, they age. So,
Yeah.
but I think that we're going to see a world where mental health concerns are taken as seriously and on the same level as physical health concerns. I think that they're doing some really exciting research on our brains with different scans to see what are the effects of medications and therapy on our brain and what can we do? How can we get better treatment? Because I will say our treatment in mental health sometimes is lagging behind
Mhm.
oncology and cardiac care. But I think that we have seen a huge increase. Our PMHNP program at Texas Tech has seen just an explosion in our enrollment because people are recognizing mental health issues and they want to be part of the solution. So I think that we are advancing as fast as we can to the point that we're going to be kind of on the same level as other major health concerns and have the same resources.
Well, so you're saying then that we're probably, this is the way that it's going to be. We're just going to get better at
Well, I
addressing it, or
I think that we're going to get better at fixing it, but I think that I think that you could talk to most people and they know a lot of the important things to live a heart healthy life. For example,
Sure,
we know we
but we
need to
don't do it.
exercise. We know what a
Mm.
kind of a diet. Does everyone do that necessarily? Maybe
No.
not perfectly, but we all try, right? I think
Mhm.
I think most people try to some degree. So I think we're going to start recognizing those things about mental health that we need to do. We need to take breaks from our phones. We need to take breaks from our emails as adults. We need to make sure that our children are not completely overscheduled with all the activities and have time to be kids and play and be outside. You know, I like to share with people that was one of my favorite parts of the pandemic was we all went outside a lot more, didn't we? And we all
Yeah.
probably were a little bit more happy, even though we were living in a very difficult time.
Mhm.
So I think that we're going to get better, though we'll still continue to have some of the challenges that we have. We're going to recognize and all have this awareness to counteract some of these things at the prevention level versus letting it get so bad.
Well, and in some ways, like you said, with the pandemic, it kind of threw us into something that we weren't really prepared to handle.
Mhm.
But at the same time, even though all of that technology um, happened so fast, we didn't have the slow pace to adapt to it. That now, I guess, the end result of that is what we're talking about. But if we look at it from a positive standpoint, then as we begin to recognize, like what you said, then we learn the balancing of it.
Yeah.
And that's really where what it comes down to is how do you keep and maintain the balance? And
Yeah.
that's really kind of those things are almost, I don't know what the word is for it, but they come from our society, our culture, right?
Hmm.
Until society says, no, it's important that you have balance. You
Yeah.
shouldn't do. Then we'll be like, oh, okay, then we have permission to not check the email, to not be
Yeah.
crazy about
Yeah.
technology and
Well, and that's something that we all as adults need to role model to our future generations, right? And that's what I think, an area of interest of mine is social media and kids.
mm,
And so I give some talks at different schools about how do we role model as parents what we want our kids to do with technology. And there's all kinds of
mm,
great resources out there, which I'll give you some links for and everything, but there's a lot that we can do, but one of the things that gives me so much hope is when I work with kids, they talk about mental health in a different way than we do. They recognize it and they know it's okay to feel sad sometimes, and it's okay to talk to your friends about your feelings. It's okay to talk to your parents about their feelings, and it's okay to need help. And I think that there's a lot of hope in our future generation that we can kind of change the grind that we let ourselves get into, that the pandemic showed us is
yeah,
not a healthy way to continue.
to live. Right,
Mhm.
right. So now you said you were going to give us some tools and resources, and we'll put those in the links below the video. But what would you, what advice would you give someone that is struggling right now as they're watching this
Yeah.
with that balance?
Yeah. Yeah. So I think that, always the first step is recognizing that. So looking at those warning signs that I talked about and trying to figure out, are you experiencing those things? Are you not getting as much enjoyment from things that you may be used to? So the first step that I typically recommend is reaching out to your primary care provider if you have one. They're going to be the best resource, no matter where you are, of telling you if this is something that they feel comfortable kind of treating and discussing with you, or if you need more specialized mental health services, whether that be with a psychiatric mental health nurse practitioner, psychiatrist, psychologist, counselor, whatever that may be. Um, they can also help you figure out, do you need to see someone in person or is telehealth an option for you? And who are you going to be able to get to see the soonest? Because they have those relationships with different people in that area. So that's always the first resource that I recommend, or a pediatrician if it's a child.
Yeah, the telehealth to me is really, I think that's a cool thing. I think that's easier. I think that's um you're going to give us some links on that as well, yes?
Yes, yes, yes.
Okay.
And I like to share, in the first few weeks of the pandemic, a lot of us, we were doing phone calls as appointments, which not, it wasn't the first option, but sometimes when people didn't have a good internet connection, it was literally that or nothing. So I was just so surprised one time when I had a patient after and it was like an hour-long phone call. She was like, I can't believe how much we were able to connect and talk. And I really do feel comfortable. And I would have never thought that I would have felt comfortable sharing these things with someone that I can't even see their face. But telehealth is definitely, there's always going to be kind of questions about it. It's this new thing, but it really can be a quality service for
Yeah.
many different folks who don't have access.
Yeah. Anything else that you want to add before we finish this?
Yeah. So I hope that I've tried to convey today that while I think that there are a lot of challenges and overall we are seeing an increase in mental health concerns, I think that there's a lot of hope out there. And I always want to make sure to convey that at the end. I think that our future generations are recognizing it better. We've seen an increase in services and within Texas, there are new programs that are recruiting more and more students. And even at the undergraduate RN level, we're seeing a lot more students focus on mental health and wellness. And so while I think these concerns are here to stay, the way that many chronic health concerns are here, I think that we have so many more services available than we ever did before. And if we all kind of work as a society to kind of foster that, I think we'll be in a good place.
Yeah, I think that's the key. It has to do with our culture. It really does. There's so much that hinges on that. So,
Yeah.
all right. Well, thank you so much. I appreciate your time. And
Yeah, thank you.
yeah, thank
It was a
you.
pleasure to be here today.